Good morning and welcome to Morning Coffee. I'm Jim Cuccinata. It must be Tuesday. This is the Halo Health segment, and today we have Dr. Alita Eck, and she's going to come back and talk all things medical. And more specifically this week, we're going to talk about kind of how billing works and how there's a huge disparity in there. And us as the consumers kind of getting it stuck to us. So we want to welcome Dr. Eck back. Thank you.
Thank you very much.
And we were talking, right off the bat about your practice and the difference between a physician that's in the, let's say, the plan business and a private pay. So why don't we start there, and then we'll build our show around that.
We were going to talk about networks and this preferred provider network concept. It used to be when you get insurance, they'd give you a book, these are the doctors that are in the network. And people would then go look and they'd find a doctor that they liked, or they want to see if their doctor's in that network, and that's how they would choose to get their insurance. Right. And they would pay maybe a $20 copay, and then the bill would go off somewhere and they'd never see it again.
Right.
Now, under Obamacare, lots of people have high deductibles. So that bill goes off, but then it comes back to them and becomes part of their deductible.
Right.
And they can find that the price is way higher than if they had just walked in off the street and paid a regular price for a,
right.
In fact, you gave an example.
Yeah, so my daughter went to a doctor for a completely unrelated reason, and they noticed that she had a splinter. And when they took the splinter out, they came back when I got my explanation of benefits, they charged $400. And I was like, she took a splinter out. So I called them up and I said, so if I walked off the street, what would be the price? And they said, oh, it would be $100. So I said, great, I'll send you $100. But I really wanted to ask them, well, what would the cost have been since the person was already there and you found it? Like, there should have been even less than $100. It should have been like $50. But, it's just very interesting. As a patient, right, you're now getting these explanation of benefits, and you're starting to see something that's really scary, right? Because you have a top line of what the doctor charges, and then you have what's allowed, and then you have what you're on the hook for. And those numbers are really confusing and really
sometimes
different.
Very high.
Yeah.
I call it a form of organized crime because sometimes the bills are just so astronomical. For instance, when you go in for a normal delivery of a baby, the bill from the hospital might be $25,000. That's what's going to come back as what we call the charge master price, the sticker price.
Right.
And then it's very convoluted as to what happens. And your price might be down to, I don't know, you have to pay maybe 20%. They'll bring it down, say, to $15,000. You pay 20%. But it turns out that I've talked to the hospital administrators because I was negotiating cash prices with the hospital.
Right.
We run this free clinic, the Zarephath Health Center. And I talked to them, and they tell me, well, Blue Cross Blue Shield pays $5,700 for a delivery. I said, $5,700? How in the world are they paying that much? You're charging the $25,000.
Right.
And so people are terrified not to have insurance.
Sure.
Well, that is what prompted the whole Affordable Care Act, the fact that healthcare is so expensive that everybody has to have insurance.
Sure.
And it's partly because of this sticker price fear that we all have.
Absolutely.
And insurance companies don't mind prices going up. Hospitals don't mind prices going up.
Right.
None of the providers mind when prices go up. And often these plans are paying maybe 3 or 4 times what Medicare would pay, up to 10 times what Medicare would pay. And as long as the employers are willing to pay those premiums, which we all know have skyrocketed,
right.
then they just do it, and they keep on raising those prices. And that's why we have administrators of hospitals. Maybe there'll be 50 people in the hospital that are making almost $1 million.
Right.
And it's because this money is just flowing in.
Sure.
They're crying poor. They're saying we don't really have enough money. But wait a second.
Right. It's
Something is wrong with this picture.
Well, I was going to say, it's not being dispersed properly.
Yeah.
And in a lot of ways, it's interesting too because a hospital is growing, not necessarily because of anything any of the administrators are doing. Right? The hospitals are growing because we have an aging population and more people need care, which means there are more people going through the system, which means there's just more money. And regardless of the reimbursement, there's just more money to carve out. So, of course, these people are making more money.
There was, I remember there was 2 hospitals were merging in our city. They were talking about merging, and they had a meeting of the staff, and they said, the medical staff, and they said, well, we need to merge so that we'll have better bargaining position to bargain with insurance companies. I'm thinking, well, so you're eliminating competition,
Right.
and therefore you can raise your prices. That's what's happening, and it seems like the houses of mercy are being just turned into revenue centers.
Yes.
And just some people are making a whole lot of money off of that. I think what we really need is to get back to price transparency, where here's what it really costs to provide the service, and here's what we charge, and here's what insurance will pay,
Right.
and get the insurance company out of that that PPO, the preferred provider network concept,
Right.
and let people choose the best doctor. When you're in a certain plan, they want you to refer to people that are in that plan.
Right.
Well, you might know those doctors and might think that's not the best doctor for that particular problem, and yet you need to keep them in the plan in order for the insurance company to stay happy. And they call it leakage.
Right.
If you refer outside and go out of network. And I don't think that's in the patient's best interest either.
No, definitely not. And then if you have a specialist who's outside of the network and you go to that, then all bets are off on what your charges are going to be.
Or, yeah, the best way to do is you go to this doctor and say, look, I'm willing to pay, what is the price? And
Right.
you negotiate the price up front.
Sure.
Instead of waiting for this to run through this network stuff, because it
Right.
winds up costing a lot more.
Absolutely. And it's interesting, which we'll talk about in the next segment. All other forms of insurance are based on something. There's math involved, right? Health insurance is kind of like it's guess involved. So we're here on Morning Coffee. I'm Jim Cuccinati. This is Dr. Alita Eck, and we'll be back after these messages to talk more about how you are getting rooked by having health insurance. Welcome back to Morning Coffee. I'm Jim Cuccinati. Today my guest is Dr. Alita Eck, and we're talking about the different costs to see a doctor based on the insurances that you have and the plans that the doctor is in and the basic location, I would say, of the doctor, whether they're a hospital-based doctor or if they're an independent. In the first segment, we talked a little bit about that overview of how when the old days of the PPO first came out, or the HMO, you kind of just paid your copay, and you really didn't know what was going on in the back. Kind of the insurance company and the doctors had a deal, and they got paid. But with the change in Obamacare and the Affordable Care Act, you now have the explanation of benefits that really show how much money something costs, kind of a sticker price, then you've got the discounted price, then you've got the price that you're on the hook until you reach your deductible. Then there's some voodoo math that says, well, you only really have to pay 20% once you get up to your deductible, and it's all very complicated. And then during break we were talking, first, car insurance, right? Car
Yeah.
insurance is pretty simple. It's how you drive, and it's the value of your car. And there's a very simple equation. I'm sure an actuary would say it's not that simple, but it's pretty simple, and they spit out what it costs.
Right.
You can't do that with a health insurance.
Health insurance is tough. First of all, the cost of medical care has skyrocketed, if you've noticed, reflecting in these premiums. And mostly it's the hospital billing that has gone up so high.
Right.
And you'll find that these plans are willing to pay 5 and 10 times what Medicare pays, and as long as the employer is willing to pay the premium, they get away with it, and
Right.
they get to keep a percentage of the premium, so they're motivated to keep the premiums high. We think that insurance is there to help negotiate prices down, and that they're on
Right.
our side. And we think that going to the preferred provider in the plan gives us a VIP treatment, so therefore we're going to get the best deal with the best doctor. Not necessarily. What you do, you can just be guaranteed to pay more.
Right.
You're much better off just talking to that doctor and saying, I'm going to be paying because you know you have a high deductible. What is the price?
Right.
And kind of keep that insurance company card
Right, off the
aside.
bat.
Yeah.
Well, exactly, but it's so counterintuitive to do that because you're used to going to the doctor and you're used to handing them their $20, and then you don't know what they do, right? I mean, like I said, it was a
Right.
splinter. You know, the billing code was the removal of a foreign object. Well, it wasn't a
Surgery.
foreign. Yeah.
Yeah.
It was a pair of tweezers. They went zip, and they were done.
Incredible.
So it,
Yeah.
you know, it wasn't even deep. It wasn't even like they then took the alcohol and swabbed it. We probably got hit for that. But it's just counterintuitive for you to go in as a patient to say, Okay, so I have tonsillitis. What's the cost to remove my tonsils? It's
Well-
not something that you think of. You say, I have tonsillitis, I gotta get my tonsils out, when can we go do it?
That's right, that's right. You assume insurance is gonna pay. With the high deductibles, you gotta just kind of watch that.
Right.
And interestingly, hospitals have been buying up doctor practices, if you've noticed, so they become part of the hospital network.
Mhm.
And it turns out that Medicare is willing to pay a lot more for the same doctor's services in the same location as the hospital is billing for it than if the doctor were billing it himself. And so more money now is flowing into
Right.
into that practice. So the doctor actually earns more because now the hospital can pay him a little bit
right.
more. But somehow it's the payer, the rate payer, which could be the taxpayer, and the employer, and the patients are just all getting on the hook for a whole lot more than they used to be. And so that's kind of why the reason why medical care has increased in cost
Sure.
so much,
And,
not
and the
necessarily
employee,
value.
the employee as well, because, a lot of, back in the day, the employer paid 100% of
That's
the
right.
insurance. Now they're only paying whatever the mandate is, which
That's
is
right.
probably, I think, about 20%.
It's essentially coming out of that employee's paycheck, and they're actually earning less because the total amount to employ a person has gone up so high because of the healthcare costs.
Right.
So there's a fellow by the name of Dave Chase who wrote a story about it. He wrote The Big Heist, and he thinks that the preferred provider network concept has been the reason why we've had so much healthcare inflation,
Right.
and something that we really need to pay attention to, a little bit more price transparency, and I think we would we could solve the problem. So I think what people should be doing is paying directly for
Right.
the medical care, either through a membership model, which is now becoming direct primary care, or just pay directly for the services, accruing the deductible as you can, and then have the insurance be high deductible. I have no objection to that as long as it's reasonably priced.
Right.
And then
And they're
that's
getting
kind of the
something
better
for it.
way. Yeah, that's the better way to do healthcare instead
Sure.
of having it all run through insurance, which is what insurance companies love.
Right. Well, if you think about it, right, so the insurance company has employees. The employees tend to get standard of living increases. Then all of the doctors that are part of the hospital network or whatever, they're all getting raises. Their staff's getting raises. All the administrators are getting raises. So every year, everything's going up 6, 8, 10%, and
And
care doesn't
employees
change.
can't pay that, yeah.
Yeah, it doesn't, and if you're a small business and you're doing well and you're offering,
Insurance.
health care for your employees, you are giving people a 10% raise. It's just not in their pocket.
That's right.
And,
That's
and,
right.
and that's a really difficult conversation to have to your employee, to say, you had a great year, but I can afford to give you a 3% dollar raise because your benefit package went up 15%, and I have no control over that.
That's right. One interesting thing is, as physicians write prescriptions, sometimes they don't realize what things cost.
Right.
And some lady told me about her baby had a diaper rash, so she was given a prescription. She went and got the prescription, brought it to the pharmacy, and it was going to be $500. She says, "Wow, $500! That must be a terrible diaper rash. I
Yeah.
feel really bad that I let this get out of hand." Well, it turns out I looked it up, and I found that it's 3 ingredients, and those 3 ingredients are all over the counter.
Right.
If she went to the store and spent $10 on the 3 creams, mixed them together, she'd have the
The
same
same
thing.
stuff.
And so that's another form of price transparency that I think doctors should be aware of.
Right.
That, when you order something, kind of pay attention to what it's going to cost,
Absolutely.
and don't order something that's going to break the bank. Of these
Absolutely.
poor-
Well,
these poor people.
and something like a diaper rash.
Yes.
Because like every baby gets one.
Yes, that's
Right. Regardless of how good the
He used
parenting is.
Desitin, it was fine.
Yeah. I was going to say, I was going to plug Desitin as well. Which is funny. If you were going to give advice to a patient who, has one of the high deductible plans, is kind of stuck in network because they've got that fear, how would you recommend them dealing with their...
I would say ignore that network. For the primary care, find a doctor you trust, tell them you're going to just pay them directly, and you'll find that those prices will be a whole lot less than that in-network doctor. So
Right.
don't let the network fool you anymore. I mean, it used to maybe be a little bit reasonable, but now it doesn't make any sense. Then, when you go to a specialist, if something is major going on, you're going to be starting to reach that deductible anyway. Things are a little bit different.
Right.
But chances are only 92% of us will not go over a $5,000 deductible in a
Oh,
given
wow.
year. So chances are you have a good doctor who you know, you can call, he knows you, you work with him, and I think that's the way to go. Who knows you through the years,
Right.
keeps track of everything that's going on with you. I think that's a far better way than, especially when you have to switch doctors because you switch plans.
Right.
That doesn't make any sense.
It doesn't make any sense either,
Yeah.
exactly. And the math really is crazy because you think about it, your families are typically spending $1,200–1,500 a month for coverage. Then they have a $5,000 deductible, so now the next thing you're looking at, they're spending $23,000 before they really start getting any coverage. That's not fair.
That's way too much, yes.
Right. So we will be back after these messages. We're going to wrap up the show. We've got a couple other things to talk about with Dr. Alita Eck, and we'll be back after these messages. Welcome back to Morning Coffee. I'm Jim Cucinato. I'm here with Dr. Alita Eck, and we're talking about how consumers can save some money by talking to their doctors. And one of the first things we were talking about in the first segment was kind of how the whole being in network kind of is stacked towards making the health insurance and the hospital systems more money. And in the second segment, we're kind of talking about how, as a person, you can navigate your way through this a little bit better. And then in this segment, right, really what we want to talk about is how to be careful when you're picking kind of your programs as well, because how you pick your insurance program for the year greatly affects not only the service that you get and how much money you have to spend out of pocket every month, but then the gotcha of the deductible.
Yeah, unfortunately, with the Affordable Care Act, all the programs are about the same, all of the insurance policies, because they're mandated to cover all these extra things, and then the deductibles are mandated, and so you really don't have a lot of choice anymore. That is what I would love to see if the repeal happens of Obamacare, because there are major problems with Obamacare. And then what you want to see is people be able to choose a plan that they want, with a deductible that they
Right.
want, with the coverage they want, from the state they want, and that would be far better.
Absolutely.
So that you really have choices, not this fake choice that we now have, just
Sure.
choosing the logo on your card.
Yeah. And the other thing that's really interesting, right, is if I want to change car insurance, people, or if I want to change homeowners or life insurance or anything like that, I can do it 24/7.
Right.
Anytime I want.
Right.
I can wake up and get my bill from so-and-so and switch to Geico. And I can do that anytime I want. You can't do that with health insurance. You're
Right.
kind of locked into
The pre-existing condition problem is a problem. And essentially everybody eventually has an illness that is a pre-existing condition,
Right.
because that's the nature of our human condition.
Mhm.
And so it's a little bit more complicated, but there are better ways to help those who have expensive problems that need
Right.
help paying for them. It's better than trying to put everybody in the same pool, driving up the cost of the insurance, where the young people say, I'm not going to pay that.
Right. And
they can't.
And they don't need it.
Right, they
Right.
don't need it and they can't pay that,
Right.
because it's just so unbelievably expensive.
Yeah. When I first started working, I remember that they said that basically when you worked for a company, 50% of your salary was covering taxes and benefits and 401k match and all that type of stuff. Unfortunately, because wages really haven't risen and expenses have, now it's closer to 70 or 75% that you're getting a quote compensation package that you never touch. And it's really hard to explain to somebody, well, I can pay you $15 an hour, but you're costing me another $7.50.
At least, that's right, that's
And-
right. And people don't realize that their paychecks have been flattened because
Right.
of all of this mandated benefits that the government has put onto people.
Yeah.
So there are some people who are saying, well, oh, this is all proof. The insurance companies are all rigged and they're unfair and they're too expensive. That's why we need single payer.
Right.
And I say, hey, wait, just stop a minute. So if you have single payer, that single payer is no competition. It's a government organization which really doesn't have the same doesn't have compassion, isn't competing for you, because you have no place else to go. You better really think long and hard before you ask for that,
Sure.
because you're going to have people just saying no to you. You can't have that. You can't have that.
Right.
You can choose vanilla. You can't choose anything else. Your options are very limited in what treatments you have.
Right.
I don't think you really want that.
No, definitely not. I mean, it's interesting because there's an institute in Philadelphia that is renowned for a specific type of sports injury, and it's not covered. So you come with cash or you don't go. If you need this type of procedure done and you're in that, that single payer type world, people like that will never be found. You'll never
right.
get that help
That's right.
because they're not in that scope. And there'll be a lot of people suffering.
There's a reason why people come to the United States from all over the world to get good medical care.
Right.
And that's part of it, where there is a freedom for us to innovate, and we're not constrained by what government will pay for.
Right.
So I think there are better solutions than single payer. Obamacare is not a good solution in my book.
Right.
And hopefully that they're not just listening to insurance company executives when they come up with the replacement for Obamacare, because I think that's going to fail too.
Sure.
They need to talk to practicing physicians and patients, people who are real stakeholders,
Users.
people who really are in the trenches working and taking care of patients as to what would be the better way. And administrative costs have gone up 3,000%, while the number of doctors has doubled. 3,000%, that's 30 times.
Right.
So a lot of our healthcare dollars is just paying for pushing papers around and
Yep.
figuring out coding and all of that.
Yeah, we're figuring out overhead.
That's right.
So it's unfortunately towards the end of the show. So we wanted to see if you had any last parting thoughts on anything, if you have any updates or any fun stuff like that.
If you want to just go to aapsonline.org, that's the Association of American Physicians and Surgeons. They're the freedom fighters of American medicine that have a lot of good insight and to help us to navigate this quagmire of policies. But that's what I would go to. We're still waiting to see what this Congress is coming up with. I'm not real hopeful because I don't think they're asking the right people
Right.
for the solutions. I'm hoping that just give us a little bit more freedom, get the government to back off,
Right.
and allow a little bit more innovation.
Great. And then I also noticed that you have a great mailing list. Every time you have a new blog, it comes in my inbox. How can people get on that?
That's AAPS does
That is the AAPS. Okay.
Yeah,
Excellent.
aapsonline.org. Yeah, you can read all the things that I've written.
Awesome. Great. Well, thank you so much for being here.
Great.
And we'll see you shortly. I'm
Yes.
sure in another
I'll-
few weeks we'll be back to talk about something else that's
Hope you're
very
back.
interesting.
Okay.
And I'm Jim Cuccinata. You're watching the Halo Health segment, and we'll be back to Morning Coffee after these messages.